Well, it's been a very busy year with many developments in health. As 2018 draws to a close, Africa 54 health correspondent Linord Moudou is here to take us through some of the year's highlights. Hello, Linord.
Hello, Vincent.
Quite a number of things happened. You covered a lot of these stories. Can you give us some of the highlights? What are some of the major stories?
Indeed, a lot has happened in 2018, but most definitely what has dominated African health news is the Ebola outbreak in the Democratic Republic of Congo, which started in spring, in May this year, and it's still ongoing. So 2 different outbreaks in 1 year. And this is the 10th outbreak in the DRC. The 9th started in May, as I mentioned, and ended in August, in July. And then August saw the 10th outbreak. Right now, this outbreak is said to be the 2nd largest Ebola outbreak after West Africa in 2014 and 16. So over 520 people are infected, and about 315 are said to be dead as of today.
And the battle against Ebola still continues in the DRC.
The battle against Ebola continues. There are some good news. There was the introduction of an experimental vaccine. Over 40,000 people were vaccinated, and this vaccine was developed during the West Africa outbreak. So, according to health experts, they say it shows to be working. And then therapeutic drugs also have been introduced. So, some positive aspects of the Ebola outbreak.
It's good to know. Now, that wasn't all. That wasn't all.
Much more. Indeed, much more. One of the things that I wanted to mention is trachoma. It's a neglected tropical disease, and around the world, about 21 million people are affected. It's the leading infectious cause of blindness around the world. Over 2.1 million people are affected, are visually impaired due to trachoma. And Ghana and Nepal were able to eliminate trachoma in the country. So it's really a big deal. And this year also the World Health Organization sounded the alarm on the growing problem of neglected, non-communicable diseases, rather, especially in developing countries, looking at obesity. Serious problem. It's growing in sub-Saharan Africa. Also, the problem of mental disorders. It's not talked about enough when it comes to health in sub-Saharan Africa, according to observers.
There's a lot of taboo associated with this, and misinformation,
and misconceptions. Get this, in a country like Ghana, for example, only 18 psychiatrists are practicing for over 25 million inhabitants. So imagine there is a need for more expertise, awareness, care. It's a very serious problem.
It is sad, and in fact, we did mention that there was only one in Mogadishu, in Somalia, one psychiatrist. Anyway, we don't want to run out of time because something else you want to share with us.
Absolutely. So now we're going to look at the problem of cleft lip palate. It is one of the most common birth defects in the world. And it's essentially a gap in the upper lip where the skin didn't grow together. Babies with cleft lips may also have a cleft palate where the roof of the mouth is split. Both can be repaired surgically, but unless that's done, this birth defect can cause significant disability or even death. VOA's Carol Pearson's report.
Trulio was born. An ultrasound showed he had a cleft lip. His surgeon could even tell how severe it was.
You can also tell in terms of whether it's one-sided or both-sided, and it also gives you a chance to look for other potential associated problems that these babies can have.
Like a small jaw.
In Dan's case, he's actually missing significant pieces of his jaw.
At Children's National Medical Center in Washington, Daniel had a tracheostomy, also called a trach, a surgically made hole from his neck to his windpipe because a small jaw can make it hard to breathe. About 7,000 babies with a cleft lip or cleft palate are born every year in the U.S. Around the world, the number is in the millions. Without surgery, babies like Daniel can have stunted growth, speech, and hearing problems. 9 in 10 children born with a cleft lip or a cleft palate are at risk of dying without medical help, according to Dr. William McGee, founder of Operation Smile.
More people die every year in our world from lack of access to surgery than die from malaria, AIDS, and TB combined.
Volunteers for charities like Operation Smile repair these defects and teach local doctors in developing countries how to do the surgery. Operation Smile is also involved in research.
We know that there's a genetic effect to it, and we have now the largest collection of genetic specimens in the world.
A genetic mutation is linked to about 30% of the cases. 3 siblings in one family provided the clue.
Normally, you would only see one child in a family of 3 or 4 children that develop this birth defect.
Scientists are not yet able to prevent the disorder, and they're still searching for other causes.
He's actually done really well with it.
Daniel's cleft palate was repaired in spring of 2017. He'll need more surgeries later on to create a jaw and to fix his teeth. There's a world of difference between Daniel then and the toddler he is today. He still spends most of his time in his play area, but now he wears a hearing aid on a headband because one of his ear canals is closed.
Bingo and Wally hop onto the sleigh.
He likes looking at books and playing with his sisters. He was fascinated with our camera. Robin Trulio, Daniel's mother, reflects on the changes since he was born.
He was getting sick a lot, frequent colds, and he got pneumonia a few times. He needed a lot more care. He needed a lot of suctioning through his trach. He was in the hospital a couple times, but like right now, he doesn't get sick. If he does, it's resolved quickly. He's definitely living a happy, healthy life.
Daniel can now breathe on his own. He's doing many of the things a 2-year-old normally does, and he's apparently loving it. Carol Pearson, VOA News, Greencastle, Pennsylvania.